Here's a startling truth. Stopping the weight loss jab Mounjaro doesn't just lead to regaining lost pounds. It can also erase the hard-earned health benefits you've achieved. But here's where it gets controversial. While Mounjaro has been hailed as a game-changer for shedding an average of 20% of body weight over 72 weeks, new research reveals that discontinuing it triggers a reversal in improvements like lower blood pressure and reduced bad cholesterol. And this is the part most people miss. It's not just about the scale. It's about the broader health gains that slip away when the medication stops. Mounjaro, powered by the active ingredient Tirzepatide, has become a go-to solution for weight loss, with studies showcasing its impressive results. However, earlier research already hinted at a troubling pattern. Stopping Tirzepatide often leads to significant weight regain. Now, findings from the SURMOUNT-4 clinical trial dig deeper, showing that other health benefits, like better blood pressure and cholesterol levels, also fade once the treatment ends. Professor Naveed Sattar, a cardiometabolic medicine expert at the University of Glasgow, explains this isn't surprising. Excess weight is a known driver of high blood pressure and poor glucose control, so when the weight returns, these health markers typically worsen. Sustained weight management remains a critical challenge, he notes, though he's hopeful that more affordable, long-term strategies will emerge. Here's another layer to consider. Tirzepatide and similar drugs have been linked to reduced risks of heart failure and early death in people with heart conditions. Boldly put, stopping these medications could strip away a vital layer of protection. But is relying on medication the best long-term solution? That's a question worth debating. In the SURMOUNT-4 trial, participants with obesity or overweight and related health issues received Tirzepatide for 36 weeks, alongside diet and exercise support. They were then split into two groups. One continued the medication while the other switched to a placebo. The results? Among those who lost at least 10% of their body weight initially, 82% regained 25% or more of that weight within a year of stopping the drug. Worse, this weight regain was tied to a reversal in other health improvements, from waist circumference to blood glucose levels. The researchers emphasized the need for long-term weight management through lifestyle changes and medication to sustain these benefits. But here's a counterpoint. Jane Ogden, emeritus professor at the University of Surrey, warns that relying on weight loss jabs can sometimes backfire. People may lose motivation to maintain healthy eating and exercise habits, leading to poorer diets once the medication stops. Is this a sustainable solution? Or are we setting ourselves up for a cycle of dependency? Adding another layer of complexity, a separate study suggests that women who stop weight loss medications like Tirzepatide before or early in pregnancy may face higher risks of complications, including preterm delivery and gestational diabetes. However, Professor Sattar cautions that this research doesn't prove cause and effect, urging caution in interpreting the findings. So, where does this leave us? Mounjaro and similar drugs offer undeniable benefits, but their long-term effectiveness hinges on continued use. Is this the future of weight management? Or are we missing a bigger picture about lifestyle and sustainability? Share your thoughts. Do these findings make you rethink the role of medication in weight loss? Or do you see it as a necessary tool in the fight against obesity?